Okay, should we make a start, team? Brilliant. Thank you. Welcome, everybody. Hi, lovely to see you all. My name's Lee Webster, and I'm the Deputy Chief Exec of Respect, and it's my absolute privilege to welcome you all here today. And really delighted to be launching our report today, Unsafe and Unheard, which is really about lessons from families affected by child and adolescent to parent violence and abuse. It's such an important piece of work that the team has been working on with our partners over many months, and it really advances our understanding of the experiences of families affected by CAPVA. Just wanted to start with a couple of thank yous because it has been a massive collaborative effort. And thank you especially, first of all, to our donors, the Noel Buxton Trust, without whom this work just wouldn't have been possible. And just personal thank you because you've been really supportive and encouraging and really walked with us on this journey and encouraged us along the way. So thank you for that, and thank you for being here today. And a massive thank you to TLC, our partners, Talk, Listen, Change, who we worked with to ensure that the experiences and voices of young people fed directly into the findings and, importantly, into the recommendations. So you'll hear some more about that today. We worked with a whole range of people that I'm not going to go through and thank now, but please know you're thanked, and there are acknowledgements in the report as well. So today you're going to hear from my colleagues in the Respect Young People Service, and they'll introduce themselves as they go. And we're also delighted to welcome Mairead Bagley from Norfolk PCC, who will talk a bit later about the experience in Norfolk of addressing CAPVA. So first, just a few housekeeping points. The first is that we're recording, and the recording and slides will be available after the event. Please use the chat function, and please do go and introduce yourselves. Tell us your role if you want to, where you're coming from if you want to, and anything that you're bringing today, anything that you're curious about, or what brings you here. Throughout the webinar, please feel free to either use the chat function or the Q&A function to ask questions. If you have any technical issues or concerns, you can put them in the chat, or you can message Karima or Tasha, who are managing the tech for us. And thank you very much to both of you for that. And automated captions are available for this webinar. Again, if you want to know how to put those on, please contact Tasha or Karima on that. Okay, that's enough for me. I'm going to hand you over to Alice from Respect Young People Service to tell you a bit more about what we do.
Thank you, Lee. And I have got a little bit of a lurgy left over, so I'll try not to cough, but it's mainly gone, but just to warn people, apologies if I do. So we are Respect. We're the UK charity stopping perpetrators of domestic abuse. And I'm going to do a quick introduction to the Respect Young People's team. So our focus within the larger organisation of Respect is children and young people who are using harm themselves. So that could be in their family relationships towards parents or carers, or it could be their behaviour within their own intimate partner relationships. And our jobs really involve training professionals and supporting other organisations to deliver high quality interventions, the aim of which is stopping the violence and preventing more harm in the future in terms of young people's relationships. And our roles. And this is our small but mighty team. There are 4 of us. Justine is our head of service, head of Respect Young People Service. Amanda is the RIP Service Development Manager. Helen is going to be speaking briefly later on. She's leading our project in Merseyside, and that's me, who's the implementation lead. So I think we come from a really wide range of professional backgrounds, so we kind of bring all of that expertise together. We've worked between us in youth work, youth justice, education, and specialist domestic abuse services. So we bring that knowledge and expertise to the team. And what we do, a key piece of our role really is, as the national organisation, we are influencing and innovating. We're trying to support local areas to improve their response to young people using harmful behaviour, but we're also trying to advocate on a national level. So, excuse me, raising awareness of CAPVA, advocating for children and young people, and driving innovation in the sector. So we're trying to look, this is a very new area of work. We're trying to look at innovation and best practice and developing programs and strategies that are really going to work and help families. The two main strands of our training and development work that we do are teenage relationship abuse focused, and within that strand of work we have our dating detox program, an intervention for young people which includes sessions on healthy relationships, coercive control, consent, understanding power dynamics within relationships, as well as some behaviour change work for young people who are using harmful behaviour themselves. So that we train professionals to deliver that programme to young people. And then our CAPVA, Child and Adolescent to Parent Violence and Abuse strand of our work, which is obviously going to be the focus for today. And within that, we do a lot of awareness raising, training for professionals, support around how to intervene safely where families are experiencing CAPVA. And our kind of flagship programme is the Respect Young People's programme, which is many of you I can see on the call already know about this, and some of you are delivering it and training it yourselves. But it's a 12-week programme, so it really kind of works with parents and young people to address the harmful behaviour, and it does that in a different ways. It looks at young people's ability to regulate their emotional responses. It looks at creating and negotiating agreements between parents and young people, helping parents to understand effective ways to manage difficult behaviour and challenging behaviour. So we support parents and young people through that programme. We've got other programs as well. I think a new one that we've just developed called Building Skills, which is really aimed just at the young people, and that is young people who are trauma experienced and really supporting them to learn some of those skills around emotional regulation and emotional intelligence development, really. And our approach, so all the work that we do for young people using harm is trauma informed, and we recognise that a lot of the young people who are hurting and harming others have also been hurt and harmed themselves. So we need to make sure that our support is addressing some of those issues as well. We look at a whole family and a systemic approach to preventing violence and harm. So we understand that child to parent violence and abuse is a systemic problem. It's not caused by one single thing. So when we're addressing it, we have to look at the big picture, and we have to look at a holistic way of approaching that. We keep young people always at the centre of what we do and at the heart of what we do. And I'm so excited to hear from the report today, because I think it's going to capture the voices of families, and I'm really looking forward to hearing about that. But that is absolutely at the centre of what we do. We really recognise that preventing violence generally is going to start with repairing those close primary relationships for children and families, and that is the aim of our work. And we really see this kind of ripple effect when we can support families, when we can create safety within a family environment. We see a ripple effect of benefits for children and young people. So really passionate about the work that we do. And I'm going to hand over now to Justine.
Thanks, Alice. That's great. So I'm going to take us straight into the report, which Lee said earlier, I think, that it was funded by Noel Buxton Trust, and we're really appreciative of that. I'm going to be a little bit pacey just for time, because I wanted to include everything in the slides and I absolutely couldn't. But just to introduce for people who are not clear around the terminology, we use the definition of CAPVA, and that is child, adolescent to parent violence and abuse. And what we mean by that is like harmful behaviour by children towards parents and adults and carers. And we've got the age range there of 8 to 18, but we know that it starts sometimes before that. And we know that without intervention, it absolutely doesn't end at 18. But that's the age range we use for our intervention. And unfortunately, it includes all of the forms of domestic abuse that you would see in adult intimate partner abuse. And there are a lot of similarities with domestic abuse as well. So that's what we're talking about. It's not a one-off meltdown or a kick-off. It's a pattern of behaviour usually. And so how was the report collated? So we've done it in a 3-phase process. We did some co-production with young people, which has been mentioned. We did that with TLC. Unfortunately, we weren't able to get the young people to input today, which is a bit of a shame. We would have liked to have them at the end of the process as well. But what they did was they came together and did several sessions with TLC and one of our ex-colleagues. And they did some sessions pulling together some artwork on their experiences of professionals, and I've got that on the next slide so you can have a quick look, and it's also in the report. They also did some of the questions and co-designed the survey that we put out. And the second part of the methodology was that research. And so that national CAPVA survey went out to people between May and August 2024. And we had 173 total respondents, and we asked them quantitative and qualitative questions. We got that data back, and then we had, I think, 29 staff from across the sector and across the country, in fact, working with us on our roundtable to discuss and analyse the input that we got from parents. And we've included some of the quotes, as you'll see, in the findings. And that's just a picture of the work that came from some of those sessions with the young people. That was shared on social media, generated a lot of interest. A lot of professionals downloaded it. It's a really nice piece of art. And if you want to see that in more detail, because I appreciate it's quite small on the slide, it is in the report. So I'm going to go straight into the findings now. So finding 1 from the report was that there is a lack of universally agreed definition, and this presents barriers to addressing CAPVA. And if you work in this field, this won't be rocket science to you, you will know about this. But basically, you know, there's lots of different acronyms, and without an agreed terminology, attempts to classify, record, and count the issue are fraught with difficulty. It makes gathering data around prevalence really difficult. For instance, we don't have mechanisms for flagging CAPVA on police systems or anywhere really. So we can't really accurately or easily pull data from child protection incidents to demonstrate its impact or the prevalence, like I've said. So it just makes raising awareness as well and planning for solutions and reduction really difficult. And so parents said around this, you know, I didn't get help because I didn't even know there was a word for it. The authority just dismissed the behaviour. And practitioners said, there is the need for a nationally agreed definition. This inability to talk the same language makes it impossible to collect data around prevalence. And we had many, many, many more quotes. I've just taken a couple there. So our recommendation on this finding, a lot of work was done prior to the new government coming into effect. Respect, in fact, held its own consultation, which included a lot of our partners and other agencies in the CAPVA space, many of who will be here today. And that was a really productive consultation space. There was an online consultation request from the government at the time, and we all worked really hard on this. Basically, what we're asking is that the government take hold of that and make a decision based on the responses given. And it should include developing a multi-agency task force to draft the definition, creating comprehensive implementation guidance, updating cross-departmental safeguarding procedures, and establishing a framework for consistent data collection and monitoring. So that's the recommendation for finding 1. Finding number 2, knowledge of CAPVA among staff in frontline services such as children's services, schools, health, police and policymakers is low. So practitioners working with children and families don't usually receive training or support on how to recognise and respond to CAPVA. And this means that the parents responding to the national survey told us repeatedly that their concerns were not taken seriously and they were left feeling dismissed and disempowered. This often led to isolation, with few options for support available. Parent blaming has serious consequences and can be used by the children to validate their abuse in these situations. So it's an issue that we really need to address. And some quotes from expert voices. Some of the parents said, train professionals, including social workers, teachers and health workers, to not ignore or dismiss CAPVA. I felt like I was blamed and not able to parent. And practitioners said, there is a lack of understanding of what CAPVA is and its impacts within key sectors such as in education settings, social work, police and healthcare settings. So what we're recommending is that commissioners and regulation bodies, professional regulatory bodies, must invest in comprehensive CAPVA training across universal and statutory services. So those services that interface with all children and also those services where maybe parents are reaching out to police or children's services. So we want to see parents treated with empathy and respect, and a professional response that promotes an open discussion of the issues, prioritising their safety rather than some of the responses we saw in the survey, which are likely to encourage families to retreat and hide the harm. So in our recommendation, we've made further recommendations, including mandatory awareness training for frontline professionals, standardised evidence-based training modules, integration of CAPVA awareness into professional qualifications, online professional development requirements, and mechanisms to monitor and assess those competencies. Finding 3, we need a system-wide approach. Almost half the parents identified as having experienced CAPVA in our survey said that they did not access support for the issue. They were given space to provide the reasons for this, and 68% of them felt that they couldn't access services because they were ashamed. 39% said they had a low trust in services, and 25% were worried about the consequences of seeking help. Where provision exists, the pathways to support are often routed through statutory services like police and children's services. This means that parents must ring the police and report their own children to get help. Imagine that for a second. Picking up the phone and reporting your child to the police. How desperate for support parents must be in that situation. Therefore, parents often reach out for help only at crisis point, and many don't reach out for help at all. So some of the parents said, in reality, this perpetrator is your child, a child that is loved and a child who you want to have a positive future. This all sits in the way of phoning 999 when you experience another daily episode of violence. And practitioners said, we need to provide help for young people by signposting where to go if they are worried about their own behaviour, and help for siblings in RSE lessons too. So we're recommending a comprehensive prevention and early intervention framework for CAPVA. It's essential that we make it easier for parents to gain help at an earlier stage. A system that relies on parents reporting their own children is fraught with difficulty and unfairly discriminates families from minoritized communities. Intervening earlier would help prevent escalation and reduce harm caused across the life course. And as you can see there, we're asking for low barrier referral pathways through universal services, proactive identification and support mechanisms, designing culturally sensitive, stigma-reducing interventions, providing flexible confidential support options, and integrating CAPVA awareness into community and educational programs. Finding 4, there are pockets of good practice, but often parents have nowhere to turn. Where effective targeted intervention does exist, referral routes are not easily accessible. Successful intervention depends on families being able to self-refer for help when they first realise they need external support. Offering behaviour change programmes at crisis point is much less effective. Parenting programmes suggest the parent is ineffective and can be used by the child to say, see, you're a bad parent. You've been sent on a programme because you're such a rubbish parent. It also does nothing to help support the child with regulation difficulty or give their voice. And for these reasons, we would advocate for systemic collaborative intervention with the young person and their family. There are very few possibilities for parents to self-refer to specialist interventions and statutory services, often fail to see CAPVA as their remit. The problem is complex. It straddles both adult and children's safeguarding. If a referral is made to children's services for CAPVA, the risk to the child is often overlooked, and the case is then declined because harm to parents is not considered the remit of children's safeguarding. On the other hand, parents cannot access adult safeguarding services as they must be defined as vulnerable according to the Care Act 2014 to qualify as being eligible for support. Parents are also turned away from many domestic abuse services because CAPVA does not fit within their remit, because the definition of domestic abuse refers to the harm caused by those aged 16 or above. Families fall through the gaps, leaving parents feeling helpless, frightened, and frustrated. So, expert voices, parents said, I was bounced between CAMHS and children's social care. Nothing to offer but therapies and parenting courses, which had no impact and just made things worse. Practitioners said, referrals are flooding into voluntary organisations, but we don't have the money to support the work. We recommend clear cross-sector intervention pathways for specialised CAPVA support. This should include creating ring-fenced sustainable funding for specialist services, including for buying for organisations, developing coordinated cross-sector and accessible referral mechanisms, providing comprehensive professional training and guidance, implementing robust monitoring and evaluation systems. Finding 5, professionals dismiss and minimise the risk of harm in CAPVA cases, resulting in failure to undertake safeguarding responsibility. Professionals often minimise the risk of harm due to the child's age, overlooking weapon use, sibling abuse, and potential serious harm identified through dynamic risk factors. Sibling abuse is a real issue in many cases of CAPVA. Children are deeply impacted by witnessing their parents being abused and are often also being physically and emotionally abused by the child who is harming them. In CAPVA cases, professionals must assess the risk of harm posed to the child causing harm, their parents, and any other children present. A risk indicator checklist for CAPVA exists, but there are very few statutory agencies such as Children's Services or police using it. There is no agreed shared process for multi-agency responsibility of high-risk CAPVA cases. Most young people engaging in CAPVA do not go on to seriously harm their parents or siblings, but some do, with fatal consequences. We must not disregard potential serious harm simply because of someone's age or declare someone less risky because they have not yet reached their 16th birthday. So expert voices, parents said, professionals were minimising the behaviours of the children against us, including when my husband's eyebrow was split open and he needed stitches. I lobbied my local authority for help. I had had a heart attack and was at my wit's end with how to support my son, who was suicidal. Practitioners said the use of knives and other weapons to threaten or harm in CAPVA is more common than you would think. We recommend the government and local safeguarding partnerships must ensure that robust safeguarding arrangements for CAPVA are in place in all services, working with parents, carers and children. This should include mandatory risk recognition framework, clear guidelines on age-based minimisation of risk, multi-agency coordination mechanism for high-risk cases, and funding to support the implementation of systemic change required. And finding 6. This is the final finding of the report. The public has limited awareness on CAPVA and lacks clear guidance on where to obtain further information. A public awareness campaign would help educate family and friends on how to be better allies to parents affected by CAPVA, and would help extended family to spot the signs and encourage them to offer support instead of what is often ridicule or disbelief. Poor responses from external family and professionals can exacerbate the issue and allow the child to feel validated in their abuse. The lack of public understanding exacerbates shame and stigma and prevents families from seeking help. Expert voices, parents said, the issues need to be talked about more. I didn't know where to go and I feared I would be judged. Also, I didn't want my child to get into trouble. Practitioners said, young people and parents do not know what CAPVA means. We recommend increased public awareness to reduce stigmatization of families experiencing CAPVA. We cannot solve a problem we cannot talk about. We need to increase understanding and help rather than blame parents. Blaming parents just ensures that the majority of what's happening in these cases remains a hidden harm. Public awareness should include multimedia public awareness campaign, a public messaging strategy, removing parent blaming, mechanisms to access support, including a helpline, web chat support, and signposting to appropriate services. And here are the recommendations in full. So a government must introduce a national definition of CAPVA. Commissioners and professional regulatory bodies must invest in comprehensive CAPVA training across universal and statutory services. Local and national commissioners must develop a prevention and early intervention framework for CAPVA. National and local government commissioners must ensure dedicated long-term funding and develop cross-sector intervention pathways for specialised support. Government and local safeguarding partnerships must ensure robust safeguarding arrangements for CAPVA are in place, and increase public awareness and reduce stigmatisation of families experiencing CAPVA. So for people working in the same sector as us, I'm sure none of those are a huge surprise. I'm going to now pass over to my colleague, Helen, who is going to talk about one of our approaches in trying to solve some of these issues.
Thanks, Justine. Morning, everybody. My name is Helen Last, and I'm relatively new to Respect Young People Service as the Merseyside Regional Lead for Child to Parent Abuse. And I just want to take the opportunity to briefly highlight, like Justin said, a couple of ways in which we are building on the successes and the recommendations that we've just spoken about. Our Merseyside project will look to work very closely with universal services so that families seek support before reaching that point of crisis. And as part of the project, we're going to be reaching out to key statutory and voluntary sector agencies to support the development of a multi-agency steering group. And this will allow us to identify what's needed across Merseyside and how we can work collaboratively to co-develop plans for improved services. And by delivering CAPVA awareness training and our Respect Young People's programme, we'll ensure that we build a network of trained practitioners in Merseyside, beginning with a particular focus on education and health services in this phase of the project. And throughout, what we will do, we look to develop clear and concise referral pathways for support in the region, working in partnership to reduce that stigma and shame that is often associated with CAPVA. And furthermore, our aim is by the end of the project to become a single point of contact within the area. And I quickly must mention a special thanks to the Peter and Dorothy Robinson Charitable Trust for supporting the Merseyside project. Thank you. I think I'm passing back to Lee. Thank you very much.
Thank you, Helen, and thanks, team, for presenting that. And just a plea to everyone, if you do have questions or comments, please put them in the Q&A or in the chat box, and we'll come back to them in a few minutes. But I'm just now going to hand over to Mairead Bagley from Norfolk Police and Crime Commissioner. And just to say here at Respect, you know this, Mairead, but we're really proud of our relationship with Norfolk. It's a really important relationship to us and that of our local partners there. And we're really excited about the great work happening really across the county to address CAPVA. So I'm looking forward to hearing from you, Mairead, and your perspectives on this work. Thank you.
Thank you, Lee. That's so kind. Good morning, everyone. I'm Mairead Bagley. I work for the Office of the Police and Crime Commissioner in Norfolk, and I'm currently the project lead for what's known as the Norfolk CAPVA project. So I'm really pleased to be here this morning and to have been invited by Respect to speak about the work that we're doing in our county. And we've worked really closely with Respect now since 2023 to address CAPVA in our area. So, as I've said, the project began as a 2-year pilot in 2023, and this is funded through the Home Office. The project came about because of the initiation of being motivated by 2 core aims. And the first aim was around raising awareness of CAPVA. The second was to provide access to dedicated and specialist support for families affected by CAPVA, as we realised within our county there was definitely a gap within the provisions available. We had heard from families experiencing this type of abuse that they feel stuck between a rock and a hard place, and they themselves have said sometimes that they don't necessarily know how best to cope with their situation and also where to seek support. So the project, we've really proud to say that we have worked with many families to help transform the support available in our county, and this in turn has really helped families to navigate these difficulties. So I'm going to briefly talk. I've only got 10 minutes and I could go on and on and on about all of the wonderful things that this project has achieved so far. But how have we managed to transform the support available? So we have in Norfolk established a system-wide approach through the CAPVA partnership, and this is formed of Respect, the police, children's services, health, education, youth justice, and our local domestic abuse service known as NIDAS. So since 2023, Respect have trained 74 professionals across Norfolk. All of those professionals are able to deliver the RIP. These workers are situated within children's services, youth justice, NIDAS, and more recently and excitingly, schools. And I'll come on to talk to that in a little bit later on. So far, our project has supported 101 young people, and I'm really pleased to say that this number continues to increase. If you could just kindly move to the next slide, please. Thank you. So the early findings, I will go on to say that there is going to be a full independent academic evaluation of our project, which is being conducted by the University of East Anglia, and we're expecting that to be published in spring of this year. So we can touch upon some of the fantastic results that we're seeing so far, but I can say with confidence that this is going to be much faster than this, and I think there'll be more elements of some of the positive changes within families that perhaps I've not mentioned here. So to begin with, we've seen 100% of practitioners who have delivered the RIP have reported a reduction in violence and abuse for families that have completed the programme in full. We've seen 95% report a result in a positive change for the family, and 78% of those families, the change for them was significant. We've also seen from children themselves who have completed a pre-questionnaire and a post-questionnaire after completing the programme. 100% of those young people have said that the programme has helped improve their relationship with their parent or carer, which is just fantastic. And then we've got 93% of parent and carers who have also completed the same pre and post questionnaires, have said that the programme has really helped improve their relationship with their child. Other anecdotal feedback from parents, as well as practitioners delivering, have seen and observed positive changes in improved school attendance. There's also been the reduction in the need to involve or call the police or other services such as children's services. There's also been, which is really positive, for the young people that have participated in the programme, we've seen them increase their social activities and also increase their peer relationships, which I think when we started the programme, we weren't necessarily expecting to see those sort of results, but we've seen a real notable increase in peer relationships with those young people that have engaged with the programme. And then the other one is the improved engagement with mental health services. And this has been evident for not only the young people, but also the parent and carers. So many of our families have been signposted to onward support after engaging with the programme, which previously they've said themselves they wouldn't have necessarily sought help or engaged. So I think it's been really, really fantastic in terms of the rapport that our practitioners here in Norfolk have developed with these families and built back trust that maybe perhaps previously was lost when engaging with statutory services. So as I say, we're hoping that that full report of findings will be available. And obviously, we're not just keeping that within our county. We want to, you know, spread that and distribute that across the UK to improve services and best practice elsewhere. So I will keep you all posted when that comes out and share that with respect.
Mairead, maybe if I can start with you, because there's a question that came up specifically on your presentation, I think. Really good to see schools stepping up in Norfolk. Can I ask what types of teacher roles have taken up the RIP training and how are they freeing up capacity in their school day to do it? Or is it mainly pastoral staff doing that?
So we've actually got a real range of roles. So some they're the designated safeguarding lead, for others the pastoral support. In one school, it is independent and it is a smaller setting. The actual head teacher themselves is trained in the RIP and delivering. So it's based on, you know, we're quite flexible in terms of who carries out that role within the school, as long as they're able to commit to the length and the structure of the routine of the programme. So we haven't to date had many challenges with time and capacity. I think the reason being is that prior to going out to schools, we actually did do a survey of need, and it became very apparent within the schools that they didn't feel that they were best equipped to deal with CAPVA, and they didn't know where to signpost families, but also could recognise the benefits to them as a school in terms of education and attendance for them. So I think there was buy-in from the very beginning. We were really fortunate to have that buy-in, and that went higher up to the heads of schools to really allow their staff to be able to deliver. And at the moment, we've sort of said one family at a time is sufficient. So we're not putting massive pressure of saying you need all of these families to complete, which I think has also helped a lot.
Brilliant, thank you. Are there any reflections from RIP's team on that?
No, I think Mairead's covered it. I think yeah, it doesn't really matter whether it's pastoral support or teachers. We've actually got a head, I think it's a head teacher or a deputy head teacher delivering RIP to families in Norfolk, which is amazing. And so, yeah, I think I would agree with what Mairead's saying, that the benefits for school are there. You know, if we help the families at this earlier point, a lot of the issues that CAPVA families can have is around getting children into school, and also sometimes, not always, but sometimes the behaviour of the young person is quite anti-authoritarian in school as well, and can be disruptive and things like that. So the skills that we teach on the RIP really help to alleviate some of those concerns and difficulties that schools have with children who are struggling with CAPVA.
Thanks, Justine. Okay, moving on to the next questions. Thank you, RB, for sharing your experience. And RB asks, I don't know if there is anything specific for neurodivergent families and the importance of intersectionality, and I guess the importance of understanding the barriers to getting help from an intersectional lens. So an example of a person who is 13, mixed race and autistic, and when the police have been called, he's been threatened and a parent was blamed. So Justine, I know you've got, do you want to talk about that?
Yeah, so it's like a mix of things, but in terms of the neurodivergent, we have done a lot of work. So we did some research with York Educational Psychology Department in Dartington Research Lab a while ago, which came up with it did a lot of focus groups and things like that on ways to approach this, and we've incorporated a lot of the learning from that research into alternative exercises for the RIP programme that might be helpful for children who are neurodivergent. Obviously, they're not a homogenous group, so some will work with some children and some won't. But for instance, we have like a self-talk exercise in the programme that we have given an alternative for, because it's based on iceberg, which can be quite imaginative, and some young people with neurodiversity might struggle with that. So we've given an alternative where we do the same work, but we do it in a storyboarding way, which might be more accessible for some young people. So, and there are instances of swap outs that we've got that we can use with children. And a lot of the discussions that we have in practice support sessions are around being responsive to young people in that group. In terms of the intersectionality with race, that's one of the things that we've really we highlighted in the report, and why we're really pushing for this more universal approach to helping families with CAPVA, because we recognise that families who are from minoritized communities or might face additional barriers to going to the police or children's services, and maybe, you know, really concerned about the consequences for them and their children, and rightly so, because those children are often overrepresented in youth justice data and things like that. So we need to really acknowledge that, and that's why we're really passionate about pushing for, you know, responses in school and in the community and health and places like that, where everybody can feel like they're going to go and be listened to and not worry about what might happen as a result.
Thank you. There's a great question from Joanna about the evidence base on the scale of CAPVA, juicy one. How has that been addressed and identified in areas where response and projects have been established?
Yeah, I feel like I'm answering everything, but I'm happy to answer it if nobody else wants to come in. So the prevalence of the issue is something that we really, really struggle with. Even where we've got some police data, it's obviously only for 16 and above, because in order to qualify as a domestic abuse incident, the perpetrator and the suspect have to be over 16. So it's a really tricky area. So it's not something that I think we've massively managed to conquer yet, which is frustrating. But I think that the recommendation that we're making around the definition and the request for, you know, flagging and screening will really help in that respect. So what we want to see is that once we've got a definition for CAPVA, or whatever it might be called when the definition comes through, we hope, that we will then be able to track and flag the issue on children's services, so like systems, police. We might even be able to track it through schools and things like that, so that we can get a better idea of prevalence, because at the moment, like, we really don't have any clue about how prevalent it is. What we know anecdotally is that it seems to be increasing, or that people seem to be coming forward more. And there was a freedom of information request done a while back by BBC that looked at actually the figures from, I think, about 19 police forces across the 43 across the country. They were the only ones that were recording the relationship between the suspect and the victim, so they could pull them out. And what they'd seen was there was a trebling since 2015 to 2018 of reported cases. So there's a lot of answer in that, but I hope I've answered what he or she was asking.
Thank you. And I think this will probably be back to you as well, Justine. Luke's asked a question that's very close to my heart around the language we use. We've talked about the definition of CAPVA and the lack of a national definition, but Luke's curious around the language you use in the sector, and particularly hearing how we talk about young people who cause harm. And obviously, as respect, we talk about perpetrators of domestic abuse, and even within that, there's an evolving conversation. So just if you could reflect on, yes, some of that around why we talk about young people who cause harm.
Yeah, so it's really important for us in RIP's team to not label young people as perpetrators, while sometimes the work might involve an element of accountability and the young people taking responsibility for some of the behaviour. Usually young people in this circumstance have a myriad of reasons as to why this behaviour is happening, and it's really important not to label them as perpetrators at the age of 11, 12, 13, 14, whatever, because that label is going to sit with them throughout life and become a self-fulfilling prophecy. So we feel it's really important to just maybe refer to them as young people causing harm. If we have to, use any terminology at all, we generally would just say young people. But for the purposes of the report and working out who we're talking about, we would say young people use and harm. And I know it's something in the respect strategy and things like that I've been very kind of clear to highlight, so that we don't use the term perpetrators when working with young people, because young people are sometimes engaging in this behavior because they're neurodivergent. Sometimes they've experienced domestic abuse previously and that's impacted, and so it's not helpful to use this these labels that kind of put the child in this position of in a position of being an aggressor and things like that, when actually behaviors might be a natural response to things that are going on in their lives, and we just need to help them manage it.
Thank you. A couple more quick questions. Does there have to be a history of domestic violence within the family for a referral to CAPVA?
Absolutely not, no. So as I just said, there's a whole host of reasons why CAPVA can happen. And if people are interested in the reasons, I could do a small plug for our training, but I won't. I'll refer them to the CAPVA literature review. There's a rapid lit review. It's got an ecological model if you wanted to see all of those reasons, but there's lots and lots of different reasons as to why CAPVA happens. And so you can refer the young person regardless of their background. If they, and obviously we don't take direct referrals, we train practitioners and help them with their project. But usually what happens is families can refer in or be picked up if they have a child who's exhibiting any of those behaviours that we saw in that definition slide. So if they're, damaging property in the home, if they're being physically violent towards their parent, if they are, smashing things up in order to get money. Sometimes we see emotional abuse and preventing the parent from going to different places and coercively controlling the parent and things like that. Any of those behaviours we would look to address in the RIP programme. It doesn't really matter why or how that circumstance came about.
Thank you. And the last couple of questions just about the delivery of Respecting People's programme. Is there support available for siblings impacted by CAPVA, and does the programme include non-violent resistance techniques?
So it does include some non-violent resistance techniques, but there are some differences. We don't tend to advocate for the sitting in as much as non-violent resistance does. So if parents and young people want to separate out and do time out, they can do that. Sometimes it's better to de-escalate in that way than encourage parents and young people to sit together when crisis has happened. So there are some differences. And what was the other part of the question? Because I started at the back.
Siblings.
Siblings. Yeah, so there's not enough support for siblings. I don't think it's not incorporated in the programme, although sometimes we do involve siblings in the family agreement to encourage fairness and to de-escalate the situations, especially if siblings are engaging in behaviours that trigger violent behaviour. But Alice wants to come in. Do you want to come in on the sibling issue?
I was just going to say that I was going to give a shout out to some projects. I know SWACA in Liverpool and TLC are delivering the RIP alongside specific support for siblings. So we'd kind of recommend that as an example of good practice, really, just to flag up that it's not consistently being done, but there are services that are delivering that service in that way.
Good shout out. Yeah, good shout out. But it's needed, definitely. Like the impact on siblings is real and serious, and so yeah, we need to help them.
Thank you. And that brings us to the end of the Q&A and the end of the event. I just want to say a massive thank you again to everybody huge thanks to the team for all your work in putting this together, including Karima and Tasha. The report is now live, so there'll be a link in the chat, and we will send you an email with a recording of this event and the slides soon. And please do get in touch if you'd like to talk to us. We're looking at our plans for rolling out the RIP over the next year, so if this is something you'd like to think about or talk about having in your area, we'd be really happy to hear from you and to set up conversations, so please do get in touch. And thank you, and enjoy the rest of your day.
Thanks, Lee.